Hello, everyone, and welcome to Inside Healthcare. We begin our program with a close look at concussions, in particular sports-related concussions. Did you know that nearly 3,000 Minnesota high school students suffered sports-related concussions during the 2014 school year? With football, soccer, and other youth sports currently underway, a local doctor joins us to talk about what you need to know to protect your young athletes from concussions. And we're very pleased to have with us Dr. Carolyn McClain, a board-certified emergency physician, and with the urgency room and assistant medical director. So thank you for being with us.
Yeah, thanks for having me.
So before we talk about how to protect, maybe we can talk about a little bit about what exactly are concussions. What's happening when you have a concussion?
So a concussion is, by definition, a brain injury. So what that means is that your cells are connected to all of a number of other cells. And when you have a brain injury, those connections are broken. So normally, and they are difficult to explain. So normally how I think about it is I had to get here today from Edina. And the way I normally take is closed because there's a ton of road work. And after a concussion, your brain normally has to do math like 2 + 2. It has a little route, it goes, but now that route's broken and it has to repair that route. So in order, you can still get the answer, but in order to get there, you have to take a different route, which takes you longer and requires more effort. So that's what a concussion is that the normal patterns in your brain have broken down and you need to use different routes to get to the same place. A more serious head injury usually has bleeding in the brain and actual cell death, but a concussion, by definition, you can't see on a CAT scan, you can't see on an MRI. The way you can see it is to see how much glucose uptake the cells are using, but that's a pretty intense test.
And concussions can be from mild to severe, the whole gamut in between.
Yeah, but the interesting part about that is we used to, when I'd see you in the ER, I would say, you have a mild concussion, you have a severe concussion, but we don't know anymore which one's which because time will tell. So let's say you have nausea and a mild headache, and for you, you might have that for 2 months. Well, that's a severe concussion. You have it for 2 months, or you have a really bad headache, you've thrown up, you're off balance, but in 3 days, you're back to your old self. That's a mild concussion. So we can't diagnose that initially in the ER. All I can tell you is, yes, you have one, or no, you don't.
So how do you diagnose someone with a concussion? Especially initially, too, right in the ER.
So normally, the first person to diagnose a concussion is the person that saw the accident. So let's say you're a soccer player, or I just had a goalie who went out to catch a ball and hit the side of the net. So he hit his head, he was knocked out. When I saw him, he just had a mild headache. But he was knocked out. Everybody saw him hit this. And so just by definition, if your brain stopped working, even for 30 seconds, that's a concussion. So
when you're knocked out, your brain is not working?
It's working, you're still breathing. It's working, but it's not conscious. So it's not working as well as it should. And if that's the case, then you have a concussion.
So what advice do you give to coaches, parents, other athletes? What are the signs and symptoms that they should be looking for?
So now concussions are so much in the press that coaches and athletic trainers are doing a great job of noticing. And a lot of these kids, before they actually play sports, they get baseline testing, and then after an injury occurs on the field, they retest them. That's important for us to have some idea of how bad this concussion is. Each sport has a different rule book, which is because we don't know enough about concussions yet. So they kind of pick the evidence that they say, hey, so the NFL uses 8 minutes. You have a head injury on the field. In 8 minutes, if you're completely normal, okay, you can play. But other sports have different numbers. So I can't remember exactly what soccer is, but it's long, so maybe 20 minutes. Say 20 minutes you're playing without your player, that's a long time. Mm-hmm. So they each pick a different number, and that's just because our evidence, we don't know that number yet.
So you look for these signs and symptoms of a headache or confusion?
Yeah, so people feel out of it. The most sensitive is balance. So if their balance is off, certainly you don't want them to play sports right away. If your balance is off, you're just going to get re-hurt. But headache, nausea, you just don't feel yourself. You feel like you haven't slept in 4 days and you can't think straight. Sometimes you can actually see the head injury. If you can actually see a big contusion on the head,
well,
that's a good sign.
Yeah.
But most of the time, the most common thing is that people have a headache. And even if you didn't lose consciousness, if you have a headache after a head injury, that means there's inflammation in your brain. There's a little bit of swelling, and if that's the case, you have a concussion.
Wow. So what kinds of treatment do you recommend for patients that come in with these symptoms and signs and symptoms?
So there's been a lot of literature in the past couple of years about what to do about concussions, and some of it is contradictory. So some says, hey, you shouldn't exercise at all for a few days. Some says, oh, absolutely, you need to walk. There's been some...
That's interesting.
I know, it's frustrating. So there's been some evidence that electronics are really bad after a concussion. And to tell a parent your kid has to stay home, not do anything, be in a dark room, and no electronics. I'm like, yes, that's what you should do, but it's not an easy rule.
Especially for someone who's very active, they're playing sports already to begin with, yes.
So these kids are like, really? I can't text? So the most important thing is to take a break. And what does your brain do? It thinks. So even going back to school and having to sit in class is making the concussion last longer.
Wow. So when should someone go see an emergency physician like yourself? When should they seek medical help?
Anybody who has a significant head injury, if there's a contusion, if they got knocked out, if they have headache and nausea, you want to see someone that sees these all the time that can say, there's no bleeding in your brain. Because what happens is there's been a number of even high school players that they maybe got knocked out, but they looked okay. They didn't go home, they didn't seek medical care, and they died. And so
that would be awful.
Yeah, we recommend at least seeing someone that can tell you you have a concussion and not more than that. To diagnose a concussion, you do not need a CAT scan or an MRI.
Because it just won't show up.
Mm-mm. And you'd ideally avoid the radiation risk with a CAT scan if you can. And how we do that is we do a really good exam. So we have you, the kids are often like, seriously, you want me to do that? But
something very simple.
Yeah, but it's really noticeable.
And then they can't do it, and then they go, oh, wow.
I had a gymnast, and I was like, okay, stand on one foot. She couldn't do it. If you're a gymnast,
you have great balance.
Should be able to stand on one foot.
Yeah.
So those are those things that you want somebody to evaluate you, and then you want them to reevaluate you before you go back to sport to make sure that you can actually complete your neurologic exam.
And we mentioned that you're with the urgency room, and for our viewers that are not familiar with it, why don't you tell us what is the emergency room?
So essentially, the urgency room is a standalone ER. We have everything that an ER has. We're staffed with ER doctors. We have 3 of them. One's in Vadnais Heights, one's in Woodbury, and one's in Eagan. And our goal, we were large group of ER doctors, and the problem with working in the ER is that everybody that's ever been to an ER goes, oh, I have to go to the ER.
Right.
And so we wanted to try to create a place where it was not unpleasant, where you could go to the ER, you could get seen and get in and out within an hour and a half. So oftentimes people will come in with 2 bone fractures of the arm, so both their bones in their arm are broken, and they're in and out in an hour and 15 minutes, even if we had to put them to sleep. Mm-hmm. So it's a really nice place for me to work because people aren't so angry when I walk in to see them, and they're like, it's been 4 hours I've been waiting. So I think we've done a really good job of putting together a place where people can get their emergent needs met. Also, if you do have something that you think, hey, I need to be admitted to a hospital, you still can wait a long time waiting to get seen, and we can see you and then directly admit you to St. John's or United.
Mm-hmm. So unlike an urgent care, you have that higher level of expertise being emergency physicians then?
Yeah, well, and we have the resources. So there's a lot of fantastic urgent care doctors that do not have the resources that we have. We have a CAT scan, we have labs, we have things that they don't have. So for us, it's really great environment to work in.
I think it's pretty cool too. On your website too, you can see the wait time, right? You can call it up and see at this particular facility, this is how long the wait is and that.
And usually it's less than we say because you're trying to set expectations a little bit different but most of the time we get people in within a half an hour.
And I know friends have told me that's why they decided to go, because they go, okay, that there's not long of a wait and I'll get seen right away. And so if someone wants more information about the urgency room or about concussions, they can contact,
We have a website. Yep, we have a website, we have a Facebook page.
And it's at theurgencyroom.com. So final comments about concussions. What should our viewers know about concussions to protect their loved ones? Don't do sports.
I think the hardest part about concussions that I see is that these are kids, especially with hockey, they come in, they have a concussion, and they're a senior. And this is their last season, and it really matters to them.
That is so hard, yeah.
And for me to say, you can't play, is really hard.
But it's so important for their life.
It's important. And so I say, you know what? Be very careful with them, because it's not just the concussion, but while your brain is healing, it's very fragile. So if you have a second concussion while your brain is healing, you can do permanent brain damage. And I love hockey too, but it's not worth it. So that's what I would say is make sure you follow up with your doctor before you go back to play.
Because if you go back too soon, you're at even a higher risk?
Higher risk for long-term brain injury.
Wow.
Yeah, and those are not good. So that's what I would say, and I'm sorry. I know you want to play, but you got to take it easy for a little bit.
Yeah, I had active children that were involved in sports, so I know totally what you're saying.
Yeah. But sports are good for you, and they're good for you on so many levels, and it doesn't happen that often. But if it does, you have to take a break.
All right. Dr. McClain, it's awesome to have you with us.
Oh,
we really
thank
appreciate it. I know you're very busy, so thank you so much.
Yeah, you're welcome. Thanks.
Thank you. Still ahead, what's being done locally to protect our environment and our health. So stay with us, everyone.